In this video, I will show you how you can get a free certificate on COVID-19 for nursing professionals. So they've arranged a short course and you'll be able to get all the basic informations on the transmission, the symptoms, the protective measures, and all these things, that the basics that you need to know about COVID-19. And in this video I'll show you how you can attend that course and get that certificate. So first you have to open Google. So here I'm opening the Google search and type in the words INTELYCARE and click search, and it'll open, and you have the first website that opens, www.intelycare.com. so click on that and that will open in another page, and here in the red color you can see training course. So it's completely free. They have made this just for all the nurses so that they get a basic idea of the COVID-19 disease. So you have to click on register now. I'm clicking on register now, and it'll ask for some basic details. So in this page, if I scroll down, I have this register column here. So I'll enter my mail ID. I'll select registered nurse, and in the third column I will click and select I'd like to take this course for myself. And once I've done that, I'm going to click on register now. Please wait, and it'll ask you for your first name, last name and your mail ID, and for you to enter a new password. So I'll enter that, and here it opens. So what we have to do is, it'll be giving you a lot of notes like this, text. We have to read those text and then click on complete and continue, which is at the bottom, and it'll go to the next material. So they have a short video here, and the video will play.
Nursing professional education. Introduction to the coronavirus. Coronavirus, or COVID-19, is a respiratory illness that spread from person to person via respiratory droplets. Clinical personnel working in skilled nursing facilities or assisted living facilities should
So now this is a 1-minute video, and once you watch the whole video, you have to click in the bottom and then it'll take you to the next material. You have to read that, how it started or where it started, and again I have to click complete and continue. Then it shows you the symptoms, like it appears to do on 2 to 14 days after exposure, and a lot of things like the symptoms, the other symptoms. So once you read through all these, again click on complete and continue, and then the outcomes of how many will survive and how many die, the fatal rate or the death rate, and all that is put, and I'll click next. And again, next is just the heading. And finally you have a quiz over here, so you have to click continue to take the quiz. So there are 10 questions and you actually have to get 10 out of 10 to actually complete the course and get the certificate. So I will take you through those questions. So let's go into the quiz. So here is the first question. What is the mode of transmission of COVID-19 spread? So we have to choose the one best answer out of these three options. And is it droplet transmission or contact transmission or airborne transmission? So the answer is droplet transmission. So I selected that and below I click on confirm. So that's the correct answer. This answer is correct. So I click on next. What is the most common method infected will spread this disease? By breathing on someone or shaking hands or coughing and sneezing. So the answer is coughing and sneezing. So I click on that and I click confirm, and this is the correct answer. So I'll go next. The next question, who is at the highest risk to spread the COVID-19? Option A is asymptomatic carrier or someone who has the most symptoms several days after a fever or immediately after someone has been exposed. So the correct answer is someone who has the most symptoms. So when patients have the most symptoms, they are most contagious. So I click confirm, and that's the correct answer. So we'll go next. If you have any sign of respiratory infection including fever, shortness of breath or cough, to prevent spreading this to your patient, choose one best answer. Wear a mask at work, bring tissue to carry during work, stay at home as you are sick, ask to be reassigned to a different unit. The answer is, if you are sick, stay at home. So click on stay at home, and that click confirm, and this is the correct answer. So we go next. What is the best practice for covering sneezing or a cough to prevent the spread of the infection? So how can you, if we actually read before that, if you have a cough, what you should do is, should you close your mouth and hold your nostrils, or use your arm, or face the direction away from people? The correct answer was cover with the tissue and then throw the tissue in the trash. So I'll click that, click confirm. Yes, this is the correct answer. So go next. To help ensure staff wear correct PPE for each patient, choose only one best answer. Also put label of precautions on their wristband, or post signs on the patient's door outside the wall describing the type of precautions needed. Write the patient precaution on the patient's chart. Ask the patient to inform the nurse what is required to don before entering the room. The answer is actually post signs on the patient's door, so that they'll just go prepared with all the PPE while they're going inside. So that's the answer. I'll click confirm, and this is the correct answer. So I'll go next. Fit testing by a qualified tester is required prior to utilizing a respirator such as N95, surgical mask, negative air pressure room, or face shield. And the answer is respirator such as N95. Click confirm, and that is the correct answer. Go next. If a patient is suspected of COVID-19 and you don't have a negative pressure room, what are you recommended to do? I told you this before. Place the individual in a single room with the EMS, or evacuate the building, or bring them into the hallway without a mask. The answer is place the individual in a single room with closed door. So that is actually highlighted in the text before when we read it. So that's the correct answer. So I click confirm. Yes, that is the correct answer. Go next. To decrease the chance of getting the COVID-19, avoid touching your feet and toenails, anus, scalp, or the eyes, mouth and nose. The answer is eyes, mouth and nose. I believe all of you are familiar with this. Click confirm, and that is the correct answer. In order to discard your PPE and best contain any pathogens, the best location for a trash barrel is outside the patient's room, near the exit inside the patient's room, at the end of the hallway, in a soiled utility room. The actual answer is near the exit inside the patient's room. So I'll select patient's room. So I'll select that, and yes, that is the correct answer. Go next, and good job, you have passed the quiz with a score of 100%. So students and teachers, I ask you to attend this quiz. It's just a very basic quiz. You have the answers here, the correct answers, and so just try it out. And once you have done the quiz and get 100%, or you attend all the 10 questions correct, you can go to the next section, and you'll be given a survey. So basically about how you felt this course was. You can just click on the stars over here, and was this appropriate, or the learning objectives appropriate, and all these things. So you just have to give your opinion, and click on the stars, and then once you've given there are around 12 questions. So once you have actually read through all these and given your feedback, skip these comment boxes. And are you a registered nurse of this state? No. And skip this question and continue to the next section. And here you have this materials PDF file that's over here. You can download that if you want. I've already given that in the link, I guess. And below that, if you go to complete and continue, you will get this link to get your certificate. So click on that, and there comes the certificate. So you can download that, and you can save that in your phone.